All right, we're going to go ahead and get started. Hello and welcome to another Mathematic webinar. My name is Nicole Owens. I'm the Director of Marketing Communications for the organization. If you're not familiar with Mathematic, we are a membership-based trade association that works to bolster the medical device industry, primarily in New England, through education, events like this, connection, advocacy, and awareness. We have a great presentation for you today from our friends at Alira Health. They've done a recent report on robotic-assisted surgery and orthopedic procedures, and they're going to talk about the current landscape and the outlook for the year. Before I turn it over to our first presenter today, though, I do have a few housekeeping notes. This webinar is being recorded, so everyone who registered for the webinar will receive a copy of the recording. And we're also going to have ample time for Q&A. So please make sure to put your questions in the Q&A function at the bottom of the screen. And when we move into that portion of the presentation, we will take those questions. All right, without further ado, I am pleased to turn it over to our first presenter from Alira Health, Giulia. Take it away.
Thank you very much, Nicole. Thank you all for joining us today. As Nicole was mentioning, we are going to walk you through a snapshot of our recently published report on robotic-assisted surgery. I would start walking you through a little bit the chapters that we are going to review today together. So if we have a look at our agendas, we're going to start by a review of orthopedic procedures and robotic adoption today, and what's the outlook for the next 3 to 5 years. Competitive and commercial dynamics, moving to access challenges, and then having a glimpse into emerging technologies and upcoming trends in the market. Before starting with our topic, so deep diving in our agenda, I would leave the floor to Jamie for a quick introduction, and then going into the presentation.
Thanks very much, Giulia, and welcome everyone. Thank you for joining. My name is Jamie Erskine. I'm one of the senior consultants here at Alira Health's MedTech Market Access team. I'm originally a biomedical engineer, and actually my master's research was in robotic surgery, but I then moved into working in health technology assessment and clinical research, based at King's College London. I've been with Alira for about 2.5 years now, working on a mixture of market access projects, but also including ones on robotics, and I contributed to the orthopedics report that we're going to discuss today. So we'll come back to me in a little while. I'll cover some of the access challenges that we see for orthopedic robotics, and then I'll touch on the kind of emerging technologies that we're starting to see. But before we get to me, I'll pass back to Giulia, and she can take us through the robotics adoption and the orthopedic procedures. Thanks, Giulia.
Happy being here with you today. I'm a principal in our consulting team. I'm specifically focused on the commercial and strategy vertical. I've conducted a number of assignments in the past 8 years. I've been in consulting, downstream and upstream, from growth strategy to commercial due diligences, and specifically focusing on the medtech vertical within our internal areas of expertise. So surgical robotics, digital healthcare, wound care, CDMO, and delivery devices. I have a banking background, actually, and then moved towards strategy 8 to 9 years ago. Maybe a couple of words on Alira Health. The company we both work for is an international consulting company. We cover all the relevant vertical across the life cycle of both pharmaceutical and medtech products, from access, commercial, regulatory, go-to-market, patient engagement. We also offer other services on top of consulting, like clinical support, digital health technologies, and real-world evidence. Within our team, we have some, let's say, center of excellence team and group that specialize on specific topic. Both Jamie and myself are part of our robotic surgery team, dedicated team. And within our team last year, we produced the report we want to present to you today, or at least the highlights and key takeaways. So without further ado, we can start having a look at the part on procedure adoption and dynamics. I'm not going to spend too much time on the first couple of slides we have here, but just so that we are all at the same level, we can start having a look at orthopedic surgery at a glance. So in general, how the landscape look like. Of course, I think we are all well aware of what are the key segments. We can classify the different procedure in orthopedic surgery by knee and hips, spine, extremities, and trauma. Specifically for us of interest today are going to be the first two, so knee and hips and spine. While then if we move to the right side of the slides, we see the classification of the device market as it looks today. If we look at the key markets for orthopedic devices, so North America and EU4 plus UK, we are looking at the market that is currently 31 billion market, projected to grow at a stable 2 to 3% CAGR to 35 billion in 2028. So a stable and sustained growth, a couple of drivers that we are all aware about, being demographic, lifestyles, and also patient preferences in terms of minimal invasive surgeries. While if we look at the composition of, so the split across different type of procedures, we see that the leading procedures are joint reconstructions, followed by spinal surgeries, and then trauma and others. A key highlight, even if it's not of interest for today for a deep dive, would be the one on orthobiologics, together with robotics is probably the other technology that we can say is revolutionizing the market. A quick snapshot of the key players. Here we have all the strategic incumbents playing in the market today, accounting for the vast majority of the market. So we have Stryker, Smith & Nephew, Medtronic, Zimmer, among others. This is about orthopedic surgery, disregarding whether traditional or robotic-assisted. So if we go a little bit deeper into the role that robotic surgery have in orthopedics, we can say that we have a few applications of interest for us. So as I was mentioning before, we see knee surgery, hip replacements, spine surgeries, and then bone implants throughout. We can also classify robotic platforms depending on their functionalities and how they are assisting the orthopedic surgeon throughout the operation. So we can look at bone cutting platforms, screw placement platform, or passive leg support. For our presentation today, we're going to really focus on knee, hip, and spine surgeries platform. And we can have a look at how now the market in terms of robotic is looking at today and in which procedure is most used and why. So moving on to the next slide, we see that always focusing on US and EU 4 plus UK market, we are looking at, in terms of number of procedure, a market that today is around 30 million. Approximately 5% of orthopedic procedure were conducted with a robotic technique in 2022. I'm just, for those of you who are familiar also with soft tissue surgery, so we're talking about minimal invasive surgery or platform of the like of Da Vinci and others, we can already notice that adoption in this space is lower on average. This is also because we have a lot of different platforms. However, the procedure for which these platforms are certified and approved are lower in number compared to soft tissue surgery. However, the adoption of robotic within those specific procedures, for example, if we look vertically at knee replacement, hip replacement, as you can see on the right side of the slide, is significantly higher, for example, if we compare it to a prostatectomy. And we are going to go a little bit deeper into the drivers as well as barriers that are driving this adoption. Anyway, 5% can really be our target figure in this case. However, the market is set to grow significantly. And if you remember from the previous slides where we have a total market that in value was growing between like a 2 to 3%, we actually see that the robotic segment only is set to grow at a lower double-digit figure for the next year. So today, while we have approximately 30 to 32 million procedure, this is an equivalent of a 1.2 billion market value, set to reach more than 6 billion in 2030. We don't have figures or charts in the slides, but it's worth mentioning that when we look at settings of adoption, hospitals still remain the larger setting. However, when we look at United States specifically, the fastest growing market is really the one of ambulatory surgical center. It's not a novelty in healthcare. A lot of surgical procedures are moving towards outpatient settings from inpatients, and this is also valid for orthopedic procedure. Also, robotic procedure offer a couple of advantages, among which a fast turnover. It's also a key driver for marketing in this type of institution, and these are all value propositions that are very appealing for settings of the like of ambulatory surgical center. North America, United States specifically, remain the biggest market and is expected to remain the biggest market also in the coming 5 to 10 years. Then if we move into really the user perspective, what we have done while preparing this report was actually to conduct a quite extensive research, primary research, to collect the voice of the market from both procurement and clinical stakeholders that are involved in the selection and in the usage of this platform. And what we thought it could be interesting for you today was really to have a look at what are the main benefits, the key barriers, and also what are the procedures in which we expect increased usage in the coming years. Why these? So we have seen that adoption is still contained today, however, it's set for a sustained growth. So let's focus on the growth first, and let's try to understand what are the key benefits. Again, here we're focusing, of course, on orthopedic robotics. These are benefits that I would dare to say extend to are valid for robotics in general. And once again, for example, also soft tissue surgeries, but also other application. In our survey, we have asked surgeons to rank the benefit that they perceive these platforms are offering. 74%, so the vast majority of respondents indicated increased precision as a first. Of course, what robotics allow or offer in terms of benefit is more accurate operation throughout, together with better planning that allow the physician to for sure, improve the planning pre-op, but also during the operation, and then decide whether and how to proceed and also adjust throughout. It's something that has always been a big unmet need in orthopedic surgery, and robotics is partly accounting for that. Finally, better clinical outcomes. So this is also something we want to discuss a little bit more in detail in the coming slides. Clinical outcomes have always been a hot topic in robotics. Jamie will tell you more about that also in the implication on access. But we know that clinical evidence generation, which is higher in orthopedics compared to soft tissue surgery, is still a somewhat big unmet need in the market. We also have in orthopedics evidences that demonstrate improvement in terms of clinical outcome or reduction in recurrence or readmission in hospital. However, we also have studies that give us a little bit more conflicting results, just signaling the fact that it's important to invest into clinical evidence. And this is also a strategy when we look at the go-to-market that can really set apart one provider from the others. So all of these in terms of benefit, these of course are the top three. We can identify others, and if you're interested in the Q&A section, we can go a little bit deeper, but then also let's look at the barriers. Again, once if we look at the primary research that we've conducted, we will see here that I would say the outcomes from users are nothing unexpected for those of you who are familiar with robotics. Vast majority of respondents, of course, indicated the high platform purchase cost as the biggest barrier to adoption. What we mentioned before, the biggest or the most fitting setting for adoption of these platforms remain hospital, so inpatients. However, we also need to take into account that within hospital, we can segment the market down to academic hospital, large hospital, medium, and small settings. Depend on the size and depending also on whether the hospital is private, public, or academic, funding availability is going to be different. And we know that orthopedic surgery platforms are relatively cheaper compared, for example, to other soft tissue robotic platform. However, the cost still might be prohibitive for some of the hospitals. And that also, it's not only in terms of purchase of the first platform, it's also once one platform is available, not necessarily all the patients will necessarily have access to that. The second barrier that was mentioned, and also again, I would say not a surprise, is the big learning curve. surgeons need to change their workflow and need to change the way they are used to operate while using a robotics platform. And this is true for, I would say, all surgical innovation, from assisted or virtual reality, digital health, robotics, across all the different applications. Finally, longer setup time. Once again, relevant across setting, most likely more in the United States for a different system of incentives and different KPIs that are registered by hospitals setting and also outpatient setting in general. On average, the setup of an orthopedic robotic platform can take up to 30 minutes, which can be a considerably long time depending on the surgery that we are looking at. And this would have an impact on the overall workflow, waiting lists, and also cost of the operation itself and personnel. So that's also something else to take into account, and together with the number of indications for which these robotic platforms are approved, these are also other reasons that might limit adoption and penetration overall today, which, as we mentioned before, remains around 5%. Then, if we look at the different type of procedures, we mentioned before the knee, hip, and spinal fusion are really the top procedure in which orthopedic robotic surgery is used today. What we wanted to offer here is a glimpse of what's the surgeon's reaction to current usage today. And what will be the future, so growth, where it's growing more and where it's currently adopted more. And we can see that knee replacement comes in first, as we were mentioning, and this is mainly due to advantages of using robotic platforms, specifically in terms of soft tissue balancing. So we can say that clinically we have a better use case for orthopedic robotic in knee replacement compared to others. And we can also see that knee replacement is set to be the highest usage procedure, also when we look into a 5-year horizon, set to reach 52+%. This is followed by hip replacement, around 30, set to reach 38% approximately, and final spinal fusion. We know that current robotic platform and also new robotic platform will ask for additional indications. So we're going to have a look at also recent news today. But we can really expect the market to be shaped today and in the future by the evolution of these three big clinical application of our robotic platform. Just for the sake of time, I might skip for the moment the next slide. We wanted to give you a little bit of detail on the application of orthopedic robotic in knee replacement, as this is our #1 procedure. We can go into a little bit more into detail here, maybe during the Q&A, but here you just see how a knee arthroplasty differ once conducted traditionally, once conducted robotically. So reminding everything that we were saying before on how robotic can actually impact the workflow and what are the drivers and restraints, from increased precision to additional training required, longer surgery time, etc. I wanted to conclude this first section on procedures and adoption, giving you a glimpse into what is the projected value of the overall robotic market. So we have a nice comparison here with the total robotic market and robotic market as well. So you can see that we have, as we were mentioning at the beginning, if we look at the full orthopedic procedure market, a growth of 2.7%, while robotic procedures are set to grow at approximately 10%. What are the drivers? A lot of them we already touched upon. We start with new indication from current platform and also platforms that are developed to target a new indication outside of the one we already mentioned. Patient demand is quite a big and impactful driver, same as we are witnessing for soft tissue surgery. Patients are really looking for more precise, more innovative, but specifically less invasive procedure, and robotic is a great fit for that. Of course, we have rising incidence, and this has mainly two drivers: increasing in an aging population, as we all know, and also an increasing prevalence of musculoskeletal diseases. And finally, cost efficiency, which might be surprising for everything we said on the fact that actually we have additional costs and that costs remain a barrier, which is true. However, it remains a barrier when we're looking at upfront costs, but robotic surgery is set to produce savings in the mid to long term. Of course, Jamie can say a little bit more around that, but one of the key directions of research is not only going to be clinical, but also manufacturers and OEMs are expected to spend more focus into developing health economics evidences, also showing the cost efficiency and cost benefit and saving potential of these technologies in the mid to long term. On the side of the slides, a little bit recalling what we've seen before, you can see the comparison between current and expected usage within different procedure. On top of knee, hip, and spinal fusion, our top three, you see that here, for example, we have a couple of new indications: ankle replacement and shoulder replacement, for which recent approval has been awarded by FDA this year and at the end of last year. So this is wrapping up a little bit our snapshot on procedure and adoption as it is today and set to grow in the future. We wanted to complement these with some a glimpse of what is the competitive outlook and commercial dynamics. Again, we know that robotics is a growing market, relatively new compared to others in medtech. However, is already pretty crowded as well as polarized around big players. So if we want to have a snapshot of the incumbent pipeline across segments, we can see we have bone cutting and screw placement, the different indication, knee, hip, spine, plus others, and plus multi-specialty. In bone cutting, we can see that a lot of platforms are already approved, same as spine for screw placement. And we have the, let's say, giants of the market that are present here. We have J&J, we have Smith & Nephew, Medtronic, and the likes of those we mentioned at the beginning as the key players in the orthopedic space. Spinal surgery still today remains the key focus on screw placement. Another, while we see that pelvis and multi-specialty today, we have very few approved platform. One thing that is interesting to notice, we're not going to deep dive into that today, but while the biggest market today remain US and Europe, same consumers and manufacturers, APAC, China specifically, is the leading manufacturer outside the US. Something interesting also to notice is Tinavi, who's developing a robot, a platform that can be utilized across different specialties. So a multi-specialty one of the few that is doing that today, and could really be one of the trends that we might be witnessing in the future, something that we already see happening in soft tissue surgery. We can move to the next slide, just a couple of key messages here, what happened in the market recently. We have here a list of news. What's relevant to know and what we wanted to highlight is that competitive dynamics that we see in orthopedic market are different compared to those that we see in soft tissue. What we have here is many strategic players in the market that were already present in the orthopedic space that keep invest into robotic platform. On top of that, we already see some of the trends that we mentioned before. For example, we see that Zimmer received the approval for ROSA shoulder system, so new applications are there. Same for total shoulder arthroplasty by Smith & Nephew. And another thing that I wanted to highlight is what we were mentioning about clinical evidence generation. So while we have clinical evidence supporting the usage of robotic, we have some others that find really comparable outcomes between different approaches, traditional and robotic in hip replacement. These all to say that the market remain active. We also know that there's not been one of the best year for M&A and financial funding flow activity in the market. Orthopedic and robotic remains very active. We have traction on the front of partnership, M&A, new regulatory approval, everything that make us think that the growth will be sustained in the future as expected. So very quickly before passing to Jamie and the access part of our presentation, the last thing that I wanted to highlight is that one thing that is interesting is manufacturers are not only trying to overcome barriers by innovating the design and the performance of their platforms, but also focusing on their business and sales model. So as we mentioned before, costs remain one of the biggest barrier. That's very common. However, what we see also in orthopedic is that manufacturers are pretty active in designing the sales and business model that are relatively innovative. What we see here is that the revenue sharing model is most adopted compared to all other robotic applications. And when we talk about revenue sharing model, what we mean is a platform that is provided at a discount or even for free upon an agreement from the hospital or the user to purchase a certain number of or value of instrumentation. This makes a lot of sense and resonate well within the orthopedic market, where most of the provider and the manufacturer of robotic platform are first and foremost the orthopedic player. So robotics really becomes a way in the market to enhance and fortify other revenue streams that don't necessarily come from the platform, which is something that is very different compared to soft tissue, for example, if you think about that. Subscription, outright purchase, and pay-per-use are other models. Outright purchase is the standard capital purchase upfront. Pay-per-use is another relatively innovative methods. However, not necessarily so utilized because of its complexity. Pay-per-use would imply an agreement where the hospital pay a full price per single procedure. It might be appealing for smaller hospital, of course. However, as we were mentioning before, today still user focus on high volumes, hence why other revenue models might be more appealing. I will just go through very quickly as a list on those that are key commercial success factor in orthopedic. This is something that we've seen throughout. The technological design and the performances of this platform are already great and well established in the market. However, adoption still face several barriers. So according to our primary research and our internal experience, if we have to list what could be like the 5 key success factors to really look into while entering the market, key partnership will come first, of course, from engaging with the hospital, but also have a strong key opinion leader advocating for the usage of the platform. Sales and marketing focus to generate demands and awareness, and training, looking at multiple distribution channels in order to engage traditionally and innovative with key stakeholders, maintaining a competitive pricing and working on innovative and appealing business model, finalizing everything with brand reputation in terms of quality and innovation. This concludes the snapshot that we wanted to provide on competitive and commercial dynamics specifically. Thank you all for listening, and I will pass the floor to Jamie.
Thanks very much, Giulia. Appreciate it. So what I'm going to cover now is a bit more on the access challenges, really. From the perspective of payers and of providers, what are the challenges in adopting this new technology? And I already see a question in the Q&A asking about peer-reviewed data for these clinical outcomes, and that's something that I'll definitely touch on over the next few minutes. What I also want to do is take a look at soft tissue surgery as a bit of a case study, and what can orthopedics learn from soft tissue surgery, which is a little bit more mature in the market, and potentially how we can use that to make some predictions about what might happen in the adoption landscape in the coming years. And the first thing to really look at is the benefits of robotic surgery generally, and Giulia already touched on a couple of those that were picked up in the primary research. And I think those benefits do transcend therapeutic areas. So it's things like planning, things like better precision, dexterity and flexibility, surgeon comfort and surgeon ergonomics. These things are fairly straightforward at face value, and are reasonably easy to demonstrate. What is less clear is the downstream clinical and economic effects of implementing this technology. And so we do have a growing body of evidence, and that's certainly going to affect the adoption landscape in the coming years. But currently, from the perspective of payers, there are still uncertainties around the clinical and economic benefits of adopting robotic surgery in either soft tissue or in orthopedics. And what we see, and I'll talk a lot about this today, is we have very varied recommendations coming from health technology assessments. And for those in the US that may not be familiar, health technology assessment is essentially looking at the clinical and economic benefit through the literature of various technologies and using that to make informed purchasing decisions. Because we have very varied recommendations from HTAs, what that means from providers and whether that's a hospital or an outpatient centre, there's a lack of guidance and a lack of reimbursement from payers, and therefore, because of the high total cost of ownership coming from the purchase of or leasing of the device, plus the consumables, plus other associated costs and potentially even other considerations like space, with the lack of reimbursement from payers, it becomes very difficult to potentially purchase the technology that they're looking for. And when we look at the clinical and economic evidence for robotic surgery, I want to take a bit of a step back to 2019 when this paper here by Abashami and colleagues was published that really explored the value profile of robotic surgery. And this was published 5 years ago. I think some of the controversies and uncertainties that they pick up here have now been filled in, at least in soft tissue, but I think that something that we can learn from orthopedics is where the uncertainties are coming from and where we can start to fill those uncertainties out, usually through clinical and economic evidence. So firstly, looking at the literature, what we see is actually a wide range of different research designs, a wide range of different clinical endpoints, and a lot of assumptions that are made in assessing clinical and cost effectiveness of these technologies. And because of all of that, we see very different incongruent study results. And so it's very difficult to make decisions based only on the evidence that we have. And so when we don't have a very strong conclusion based on the clinical and economic evidence, we then have to look at expert opinion. But in robotic surgery, we actually see a lot of uncertainty based on expert opinion as well. How do we actually define and appreciate the added value of these technologies? Is the surgical robot better, or is it just not worse? Is it cost efficient, or is it just expense neutral? And who's the value for? Is the value actually for the surgeon or the patient, or both? Is the generator of the value the surgeon or the robot, or both? And is that value actually evident? Do we see it in the literature, or are we focused more on opinion and on clinical belief rather than on real data? And lastly, which patterns of provision actually achieve value? So is establishing robotic surgery services concentrating access for patients to surgery, or is it expanding it? Are we allowing more patients access to high quality surgery? And what volume do we need to achieve value? So what is the threshold for a return on investment? How much surgery do we need to be completing with these systems to actually achieve value? And it was this kind of uncertainty that led us to complete an expert consensus looking at best practices for the assessment of robotic surgical systems alongside HTAI and also a great expert panel of global stakeholders. And the first thing that we did was to look at the past assessments of robotic surgery. Now we completed this assessment in 2021, so it's a little bit a few years old now. And most of the assessments at that point were focused on soft tissue. But I think what we can understand from this is that these are uncertainties that can happen if we don't generate the proper evidence. And I think it's really a sign for orthopedics that as the evidence base is growing, these are the kind of uncertainties that we want to avoid. So firstly, when we looked at 99 total assessments in 2021 on robotic surgery, a common conclusion was that evidence in long-term outcomes was lacking. So we didn't have long-term mortality outcomes, we didn't have long-term morbidity or long-term patient reported outcomes. We also saw that the quality and quantity of evidence needed to arrive at firm conclusions was often insufficient. So we saw randomized controlled trials being prioritized even when they were methodologically weak. And we saw real-world evidence and observational studies deprioritized even if they were actually stronger studies. We saw a wide range of different study designs that made pulling of data difficult. And we saw a lot of differences in the clinical outcomes that were being measured and a lack of standardization. And that really makes drawing conclusions very difficult. And that's only then compounded by differences in the learning curve between different studies and differences in staff competency. And I say staff competency rather than surgeon competency because there is a learning curve for the whole surgical team and not just the surgeons. And lastly, differences in cost modelling or health economic modelling led to a really wide range of cost effectiveness ratios. So what does that mean? Well, basically, across the globe, different countries and different assessments came to very different conclusions about whether robotic surgery is a cost-effective option because they use different time horizons, they use different procedure volumes, which, as I just mentioned, has a big effect. And they use different sources of data. And so we saw, even sometimes within the same country, very different conclusions being made that makes it very difficult for payers to make reimbursement decisions based on the clinical and economic evidence that we currently have. When we don't have the required clinical and economic evidence to make a strong decision, we tend to fall back on clinical opinion. And what I want to look at now is really what the key decision-making criteria are for the purchase and procurement of robotic surgical systems. Firstly, in soft tissue, because I think that everything that we mentioned for soft tissue also applies for orthopedics, but then I want to call out a couple of potential specificities to orthopedics that I think are really important. So where we don't have strong clinical and economic evidence, where we don't have a clear consensus from payers, generally speaking, key clinical staff are going to identify the need for a new technology, and that's definitely true in robotic surgery. So in the first instance, key clinical staff generally identify the need, they scope what need there is within their own service, and generally speaking, then a tendering and business case process is opened, where a tendering process is opened where robotic platform manufacturers can pitch to a multi-stakeholder committee, including the clinical stakeholders and also the financial and hospital management stakeholders. A business case is then built, and financing is drawn from wherever it may be drawn from, and that depends on the geography and the setting, whether it's public or private care, whether it's a hospital care. But generally, there's not going to be a national reimbursement, so financing usually comes from other sources like like capital budgets, for example. Now, this all depends on whether we don't have something like a hospital-based health technology assessment program, or in the US, a value analysis committee. If we have that, then there's a much more rigid and structured process, but these are not available in all geographies. And so what we see is that, generally speaking, the decision-making criteria are based first on the clinical need and then on the potential return on investment that is assessed by the hospital management. We're not really getting into looking at clinical or cost effectiveness to any real level of detail. And when we think about orthopedics, I think there's a couple of key points that make it slightly different from soft tissue surgery. The first being that the current evidence base for orthopedic surgery is not yet as strong, thinking about clinical and economic evidence. There's also a wider range of pricing models that Giulia just mentioned, and a wider range of payment or sales models, as well as a wider or broader number of platforms that are available, which makes it a bit more or a bit less of a straightforward decision, especially from a financial standpoint, and particularly different in the orthopedic space is that we see that a lot of the surgical platforms have to be used with very specific surgical implants, at least in some of the surgeries. And so we see that surgeons who have a particular preference for a particular implant will also have a particular preference for a particular robotic system. And so we see that while clinical opinion is already very important in soft tissue today, within orthopedics, it's even more important. Now, that does not mean that that will always be the case, and I think that we can look forward to assume that it's not going to be the case as the evidence base develops. I want to come back to health technology assessments briefly. We, as I mentioned, looked at almost 100 assessments that were completed between the years of 2004 and 2021 on soft tissue robotic procedures across 25 countries, across all of Europe, the US, Canada, Australia, Asia, Brazil. And actually 16 were published in Canada alone. But at the time in 2021, there was only one HTA that had been completed on an orthopedic robotic system. But we can see that potentially as the evidence base grows, we could be about to see a huge increase in that number of HTAs, where we might see something like 99 HTAs being completed over the next 10 or 15 years in the way that we saw for soft tissue surgery. And in fact, there might even be a greater need because of the wider range of platforms in orthopedic surgery. So what does that mean? Well, first of all, I want to cover what that one HTA on orthopedic surgery is, and it was completed in the northern Italian region of Liguria. It looked at partial and total knee arthroplasty with the Stryker Mako system. And at the time, they only included 3 studies in the assessment, so not a lot of clinical evidence was available. And therefore, what they recommended was that adoption at that point should be limited to use in a research context because there was no firm conclusions made. But we can start to see that in the years afterwards, we're seeing from CADIF, which is the Canadian National Assessment Agency, they published a horizon scan on robotic surgical systems for knee and hip arthroplasties as well as for spinal surgery, so really the big 3. For all systems that were given regulatory clearance in Canada and the US. And they felt that although the evidence was limited at the time, but growing, that shorter hospital stays and lower surgery revision rates, amongst other things, could contribute to making orthopedic RAS a cost-effective option. They followed that up with 2 rapid reviews, which if you're not familiar is kind of like a mini HTA, a mini assessment that looks at only the clinical evidence and not the economic. But they looked at 26 studies covering both knee and hip arthroplasties. And although they, again, felt that there wasn't enough evidence at this stage, really pushed that further rigorous research must be done to address this topic. And I think these are the early signs that we could start to see more and more interest from national level payers and from assessment agencies to really look at the clinical and cost effectiveness of these systems to try and drive a wider adoption. And so I think what we need to be looking at from the industry perspective is how do we develop the correct evidence? How do we develop the evidence that these bodies are going to want to see? And how can we help payers make those decisions in a more informed manner? So to summarize that before I very briefly cover the emerging technologies, and then we can go to a Q&A. Starting with pricing, although we have seen increased competition in the market, we are seeing things like revenue sharing models that are reducing costs. Payers and providers still consider robotic systems and orthopedics to be high cost technologies. And so there's definitely a barrier there. And decisions are generally being made at the provider level, considering a range of clinical and economic criteria, but not really cost effectiveness at this stage because the evidence just doesn't exist. However, we're seeing that evidence grow. We're seeing the technology being refined, we're seeing the indications being expanded, and we're seeing more and more clinical evidence. And I think that is going to be a driver for more assessments and more national level payer assessments of this technology. And hopefully that will drive adoption so long as the evidence is generated demonstrating that it is a cost-effective option. And really that cost effectiveness is going to come from things like reduced hospital stays, reducing the amount of revision rates, amongst other things. So I'll very quickly leave you with a kind of snapshot again of some emerging technologies. We won't go into too much detail because I do want to give you plenty of time for Q&A. But I think one of the really exciting areas of technology in general across all of healthcare is digital technology. And within surgery, I think it's a great case study for how this is evolving. Within surgery, we're seeing a real explosion in the use of things like AI and machine learning, computer vision, virtual reality and augmented reality. We're seeing applications in imaging and remote care and home care, and even just organization within the operating theatre. But what is interesting is that often these digital technologies are being used in ecosystems around a robotic platform. Not always, but often. And we're seeing that across other technology and therapeutic areas as well, in places like drug delivery, in places like diabetes management, where we're seeing lots of different technologies being used together to generate an overall value for the patient and for the payer. One of the most interesting things about this technology in surgery is that it is used all across the surgical pathway. So it's been used in preoperative planning, where we can visualize the anatomy and prepare for surgeries using 3D modeling. We can learn how to set up for the procedure, and then we can also collaborate virtually with a mentor during the surgery and record the surgery, bookmark particular areas of the surgery that we can then analyze after the fact to identify areas where the surgery could have been made more efficient. And so we're seeing digital technologies being used all across this surgical pathway. And I think particularly for orthopedics, there's the potential to be a little bit more agile in adopting these pieces, these digital pieces, because it's a little bit less mature in the market than, say, soft tissue. To give you again a snapshot, and I'm only really scratching the surface here of what's available, but we're seeing some of the bigger players like Johnson & Johnson, Medtronic, CMR, developing their own digital surgery platforms, smart computers, apps, and virtual reality simulators, making use of technology like VR, AI, data analytics, for quite a wide range of benefits that are really focused on improving surgical proficiency and efficiency. And I think what's really interesting here is that the digital technologies can be used across multiple therapeutic areas, where robotic platforms tend to be constrained to either soft tissue or orthopedics or neurology. We're seeing these technologies that are being able to be used across therapeutic area, and it'll be really interesting to see how that plays out in the market. We also have not just the big players, but also startups. And again, I'm really barely scratching the surface here, but we're seeing a lot of really exciting startups working purely in the digital surgery space. Again, looking at surgical intelligence and data analytics, smart computers and VR. And again, these are across multiple therapeutic areas. So I think we're about to see a very exciting but very complex market. And from a payer perspective, it's going to be I think a challenge to identify exactly where the value is coming from and to quantify the value of all of these technologies that could be used in conjunction with each other. And that's something that we're really excited about, but we're looking into at Alira Health. So I think we have about 10 minutes left, so I will open the floor now for some questions and answers. I think I also saw a question earlier asking about the link to the report. At the top here, if you want to scan the QR code, that will take you to our orthopedics report that we've referenced. And if you want to take a look at the best practices paper that I also mentioned, please scan the QR code at the bottom. So thank you very much for listening, and looking forward to your questions and opening the discussion.
All right, fantastic. Thank you so much. Great presentation. We do have a few questions in the queue, so I'm going to start with this one. How do you see the role of sustainability in the adoption of RAS in the orthopedic space?
Yeah, I mean that's a really interesting question. Again, it's something that we're looking into a lot right now at Alira Health across the board, because we're seeing more and more, particularly from payers and things like national level HTAs, considering sustainability as being a really important outcome, and that kind of transcends the standard clinical and economic outcomes that we're looking at. But I think we need to start considering that. I think that there is the potential that these systems and also digital technology as well really have the potential to reduce our carbon footprint. If we can avoid people having to travel for more and more surgeries, if we can potentially reduce excess costs, it's definitely something that we need to start looking for evidence of as well. So when we are building out the clinical studies for these platforms, we need to also be including economic and environmental outcomes when we're building those studies. I don't know if you've got anything to add to that, Giulia.
No, I think, Jamie, that's I mean, definitely what we've been discussing internally. Maybe another thing worth mentioning is that it's becoming a hot topic a little bit across medtech in general. And now there are also evidence mentioning that by single procedure, actually robotic surgery procedure have a biggest impact in terms of environmental footprints. So this is likely to become a topic of interest or to act upon in the coming months. One other thing to mention again, this is really common in all industry across medtech. It's something that we are also seeing in drug delivery, for example. In robotic, this is also made more difficult, I would say, to act upon because of some business model. For example, all but one of the platforms that are commercially available today are closed platform, meaning that only the same instrument of the manufacturer could be used together with the platform, and usually comes in predefined kits. So some of the instruments are, for example, single use or limited amount of use, or not all of them are going to be used during an operations, right? So this looks a little bit like the low-hanging fruit when we are looking at sustainability in this kind of surgical operations. But for sure, it's going to be taken more and more into account. And just to say, there are low-hanging fruits, and then there are other areas along the value chain on which more intensive intervention will be required.
Great, thank you. We have another question. What are the key challenges for fully autonomous surgeries?
Yeah, that's a good question. And I think, I mean, especially from the evidence side, and understanding the value of that. I think it's a very difficult question to answer. I think that's the next paradigm shift in robotic surgery. If we get to the point of having fully autonomous robots, I think almost everything that we have discussed might well go out the window. So we need to understand what the implications are. I mean, first for safety before anything else, and then for efficacy following that, and then for cost effectiveness. So I think we're still quite far away from that at this stage, at least on the market, from my understanding. But from a payer perspective, yeah, we're quite far away, but we'll see how that develops over the next years.
Yeah, and maybe adding to that, Jamie, you were mentioning safety. Another big barrier will be the comfort of the surgeon adopting that, but also of the patients, right? This is something that we have witnessed that with the, let's say, traditional robotic-assisted surgery as well. And we are seeing it a little bit everywhere in healthcare where AI or digital surgery is involved as well. So as long as the market doesn't have full understanding or very robust clinical evidence on something that will be autonomously working outside of the surgeon realm, that's also something to take into account. There might be resistance there, not only for the safety implication, but also because of difficulties in understanding the technology and just resistance, really. People might be scared about using that technology. It's more of an irrational factors, but should be taken into account as well.
Thank you. We have a few more questions. So we have about 5 minutes, so let's keep going. Other than developing clinical and economic evidence, what can technology developers or RAS companies be doing to promote adoption? Maybe Jamie, you could start.
Sure. So I think I mean one of the first things to do really is to engage with these stakeholders. So it's to first understand from the payers and the providers what information they need to be making an informed decision. So I think the industry is already well aware of what the clinicians want and what the surgeons value, but we also need to understand what is valuable from the payer and the provider perspective. So it's really engaging with them, potentially looking at doing sort of payer ad boards, understanding what they want to see. And then also from the perspective of the payer, it's important for them to make sure that they're being really consistent in the methodologies that they're using to calculate cost effectiveness. And that's really what the paper that we put together here summarizes. But I think it's really about stakeholder engagement at this point to inform the clinical and economic evidence generation that is going to come in the next years.
Great, thank you. And maybe one last question here. What are the potential added benefits for digital technology and orthopedic surgery from a payer and provider perspective?
Yeah, I mean, there's a really wide range of benefits potentially, but again, it's going to be about evidencing those. I think one of the major benefits is actually going to be in really continuing to improve surgical efficiency. So a lot of the digital technologies are focused on things like improving training and then also assessing how well a surgery has went and revising it and potentially then improving your surgical performance. So I think even expert surgeons will be able to continue to get better. Junior surgeons are going to get better faster. And I think also it's going to just improve the efficiency all around by improving planning even further. Virtual reality means that we can do training without cadavers, for example. We can just do it purely through virtual reality potentially in the future. And then there's also the kind of communication with mentors and things like that. And these are kind of, as I mentioned, these are sort of not always specific to orthopedics because these technologies can actually be used across the board, which is really exciting. So I think there's a lot of benefits from the surgeon perspective. It's really going to be how does that translate into better surgical outcomes for the patient. But I think if you're improving surgical performance, then downstream you're going to be improving clinical outcomes, and if you're improving surgical efficiency, downstream you're going to be improving the cost efficiency of the system. So I think there's going to be a lot of benefit to the digital pieces. It's just going to be for payers to work out how to really unpick exactly where the value is coming from and what they're willing to pay for.
Great, thank you. And we did get one more question, so I'm going to try and sneak it in here. Are you aware of any DTC, DTP marketing campaigns that major players are undertaking? And how effective is this in improving patient awareness?
I'm not aware of any in particular, but I think it's a great idea. I don't know if you're aware of any sort of patient engagement, Giulia.
I honestly am not aware of any specific campaign. However, I do know, and I think Jamie, we've discussed this before as well, but this for soft tissue surgery, hospitals and also ASCs directly market the availability of robotical platform within the setting, right? And the marketing is directed to patient and to customer, let's say, quote unquote, because this is demonstrated to have an appeal on the setting and to augment the volume of procedures within the hospital. So I would say it might be partly implemented. It's not specifically targeted though, but it's a marketing lever that is being used. However, not in orthopedic surgery that I know, as far as I know at least.
Great. Well, thank you so much for your expertise today, Jamie and Giulia. Great presentation. Thank you to Alira Health for sponsoring this presentation. And thank you to all of you for joining us on this webinar today. We really appreciate your time. Please make sure you download the report or best practices. You can do so via these QR codes, or you also will be receiving the link in the follow-up email that you get after this webinar. And we encourage you to go to massmedic.com and check out all the great events we have coming up. And we'll see you next time. Thanks.
Thank you very much, Nicole and all. Have a great day. Take care.
Thanks, everyone.